concept is silly, ridiculous, it's a waste of time. They didn't want that's why they were so successful. That's why they got away.
Made a living in very dangerous.
This is really an integrated blue together.
Dianne Andrews in black and white.
Welcome to Dianne Andrews in Black and White, and I'm your host, Dianne Andrews. Thanks for joining us today, whether you're in our 3 million homes down in New Orleans, Lafayette, Baton Rouge, in our 50 parishes in Louisiana, and our 4 counties over in Mississippi. We appreciate your viewership. Or whether you're watching us on our handles that you'll see on your screen, our YouTube also is up there. We are doing a series on COVID-19. I decided to do 10 shows. This will be show number 6. 7 weeks ago, not knowing what COVID was, I came in here in my PPE with my mask on and PPE down and social distance, which we still do and we still are in the studio, and bared it all, really. Didn't know but I wanted to bring the message to you on what this virus is about. And we have to give thanks to our cameraman, Donald Trezano, even though he didn't wear a mask and couldn't get him to, but he did come in and bear it all to film the shows that we've been doing. So today what we wanted to do and what I decided to do was a show actually on mental stress and on mental disabilities during this time. Because those who think we are normal have had times of depression. You cannot help but be depressed when you're shut in. I think it was 43 states shut in. Arkansas didn't shut in. South Dakota didn't shut in. 8 of our states never shut in. If you look at this, 60% of the corona deaths are on 4 states on the East Coast, and that is New York, New Jersey, Massachusetts, and Pennsylvania. If you saw last year, we talked about the 2 different strands out there, one from Europe and one from the West Coast. And if you look at California, 40 million people, California lost 500 more people than we did, and Louisiana, which is 4.7 million people. So there are some disparities, and we know social distancing worked, but we know that the numbers by modeling, not knowing anything at the time when IHME first modeled the 3 million people that were going to die, were very inaccurate. The 1 death, again, is 1 death too many. But today I have a clinical psychologist with me, Dr. Joseph Tramontana. I call him Dr. T. Thanks again, Dr. T. We usually would shake hands because this is his 3rd time on my show. In fact, the first year, 5 years ago, Dr. T was on the show, and then a second time about 6-8 months after that. Again, he's a clinical psychologist. He has a BA in psychology from LSU-NO and an MA and PhD in clinical psychology from the University of Mississippi, right?
Correct.
He is a clinical psychologist, but I think where his passion is and his true expertise is in hypnosis.
Yes.
He's a clinical hypnosis. I've never met a person before. It's not like the people you see on MGM on TV or something at the hotel doing some hypnosis with a clock, I guess, who hasn't studied it as he has. Dr. Montana has written 2 books, one on sports using hypnosis, and one's on addictions, right?
Yes.
Using hypnosis. So tell us about the books, and then tell us what you're seeing for, quote, normal people like myself and what they're experiencing now, and especially the endangered people who are already compromised in their mental status.
That's a wide
Yeah, that's
area.
a big one. Let's start with people like me.
So,
who are you seeing? Well, you don't really see, but just as your friends, are you hearing on, quote, us working class normal people, are they experiencing things that they'd never experienced before because of the shut-in and the lack of knowing what's going on?
Sure. A lot of my friends have said they're climbing the walls, that they can't go out. These are people, I think, who were used to going out a lot, going to bars and hanging out and going to concerts.
Yeah.
And these things, and not so skilled at entertaining at home.
Right.
You know, I have other people, including myself, who think this is kind of cool to be at home and work in the yard more.
Yeah.
And put up bird feeders and see your neighbors outside. You know, I think
Because you were in Baton Rouge and New Orleans with
Yeah.
both practices, and now you're telehealth, right? Mostly.
well, but I still come to Baton Rouge 3 days a week because all my charts are here,
yeah, and your assistants.
and
here,
then
yeah.
1 day a week in Metairie.
Okay.
One of the
But not patient visits or patient
well,
visits.
just telemedicine, no,
Yeah, just
no in person.
You do it right there in your offices.
Yes.
Which you could do at home, right?
I could do it.
But you want to get up and get out sometimes, right?
I want to have my records there and my assistant there because, you know, some of us older guys aren't too tech savvy, but I have a 22-year-old assistant.
Yeah.
So if something's not working, she can talk me through it or talk the patient on the other end of the line.
Right.
Talk them through it.
Do you like it though? Do you like to tell her?
I actually do.
You didn't think you would, I don't
Well,
think.
you know, I closed my Mississippi office already, just since this happened, because I only have a few patients over there now, and they're all older folks. One of them is on oxygen and travels. She would travel from Ocean Springs to Pasquarshana. It's a long drive.
Wow, yeah. And she
her-
drove it herself?
No, her daughter-in-law would drive her. Another is in a wheelchair. Yet another's older than those two, and has various ailments. And interesting, she first saw me for multiple chemical sensitivity. She's been wearing masks forever.
Just to be in the environment. It's like that bubble boy
Yeah,
that they had to keep in a bubble immune
but,
system problem.
These people that I'm talking about seem to prefer staying home and doing it by video. So that's what we're doing. So I closed that off. So I was only there 2 days a month, but I closed that totally, and I cut back on my hours. You know, some people didn't want telehealth,
They only want to come in and be seen.
and so I've cut back from 5.5 days a week to 4 days a week, and plan on keeping it that way because I think that's healthier.
Right, yeah. And I think that the changes that we're seeing now in healthcare and in justice, the telecourts, all of those things, because these viruses will be around forever. And until we get a vaccine, which this is going to be the quickest vaccine ever. They've already started injecting people because they have some similarities, they think, to SARS-1,
Right.
CoV-1. In fact, a lady in Seattle, when I did a show 2 weeks ago, we showed her picture. 8 countries are working on viruses. But Bill Gates has said that we should stay in until there is a vaccine. Working on the virus vaccine. Has said that we should stay in until a vaccine. I can't agree with
What is
that.
his financial interest
That's right.
in that?
And probably working on a vaccine that he's
Right.
probably like IHME, who did the modeling. He paid. He's a big donor. And also, at the minimum, he doesn't have to work anymore anyway. So you can tell people to stay in because you're getting on your private jet, social distancing from the rest of the world.
Right.
So it's a whole different stance on. I'm a lot like you. I write like you write. I do the television show. I'm starting a business, but I'm a homebody. I'm at home most of the time. I'm not going. I haven't seen that much difference.
But you say that's what we were talking about the other day.
Yeah.
Some of my patients are doing fine.
Yeah.
And it's a lot of individual differences. Some people, especially people who had a lot of anxiety, their anxiety's through the roof now.
Yeah.
One lady we had to hospitalize.
Is because she's afraid of COVID-19?
Yes, but she was already anxious. Already very anxious.
Is she an older person?
She's 80, yes.
Oh, yeah.
So, but she became delusional and believed it was, we're being persecuted and we're all going to die.
She's got schizophrenia?
She's somewhat demented. She has dementia. And
Being persecuted by God or by the devil? Who's persecuting us?
Well, that's unclear. That's unclear. That's why it's delusional.
Yeah.
But she's she's out of the hospital, and she's calmer now.
Oh, I would have been afraid to go to the hospital too. I can't blame her for that.
Now I am on, and this was a psych hospital.
Yeah.
Now I, on the other hand, have some patients who've surprised me when I say, "How are you doing?" They say, "Oh, isolation is nothing. That's what I do all the time anyway."
Right,
See,
right.
They were people who really don't like to be around people.
Mm-hmm.
They're doing great with it. Mm-hmm. It varies on the individuals. I tell my patients that I define resiliency, which to me is mental health.
Mm-hmm.
Being mentally healthy is being resilient. I define it as how do you adapt to your environment when the world's not ideal.
Mm-hmm.
How do you deal with crisis? How do you adapt with a crisis like Katrina or the Baton Rouge floods or 9/11?
9/11, yeah.
This is different from all
Yes.
that. This is uncharted territory.
Because that was one incident, and you could move on. It was kind of over.
Plan on rebuilding.
Right.
And
This we don't know when it will be over. It has rebounded in South Korea and in China,
Right.
which China withheld all the information anyway. They may have a vaccine, who knows. And we were the first country to stop travel from China, thanks to President Trump.
Right.
And Italy and Spain, people don't realize they're 50 to 60 million people when they look at the numbers. We're 330 million people, legal people here in America. So when you compare the numbers, you have to look. Our mortality rate is still the lowest, or one of the lowest in the world. And we've done more testing than anyone in the world. Now, we did have some CDC and FDA problems with the testing, and China had bought up all the PPE from around the world. They make half of it. 90% of our antibiotics come from there. So what the president, to me, has been saying, which I'm getting ready to manufacture something, and anyone who knows me and knows I said before COVID, I am not getting it. I'm going to have to pay more, but I want my supply chain to be American. Because at the end of the day, you don't feed your neighbor, and your children are starving. So we cannot keep making everybody else rich while we're starving in America, like when we sent away manufacturing. And I'm so happy that they're bringing it back. But I don't know if NAFTA, the revision, ever got signed to bring up manufacturing back from Mexico and Canada, the NAFTA deal that Bill Clinton did. I've read, Dr. T, that the suicide line has gone up 1,000% in the calls you're getting to help people in the last 2 months.
Yeah.
And you had heard about opioids.
I don't know about the suicide line. That you told me that earlier today. But I just read a news brief yesterday, I think, that, and I was, a few years ago, I was on the Louisiana Commission for the opioid epidemic.
Oh, okay.
And I worked part-time at a pain clinic. So
that's right, because you're the former president of Louisiana Psychological Association and of the Society for Hypnotists, I think.
Right. But I was on that commission, and some of my workshops that I do are on hypnotically enhanced treatment for addictions, and drug abuse is a big part. So I was interested when I saw this article that the overdoses, opioid overdoses, have skyrocketed.
Have you been to any meetings of clinical psychologists or psychiatrists or any people you know in the healthcare, working with mental patients, and tell me what they've seen, like doing Katrina and 9/11? We talked about a lot of people experience PTSD also further down the road. Do you think a lot of people who do like to go out, everybody, I'm a rarity, you're kind of a rarity too, and some of your patients, but they have a disease that they like to stay in anyway, they don't like to be around people. But do you think a lot of people, because I hear a lot of people complaining, especially maybe people who are single. I mean, if you're married, I've heard of marriages who've gotten closer, and I've heard of a lot of divorces. Now, I'm also hearing about a lot of child abuse. I've read about that, and there are more domestic violence cases because people are closed in tight corners.
Right.
Are you hearing anything from your colleagues, Dr. T? Probably
the most common thing I hear from colleagues is that they all like telemedicine.
Yeah.
But I'm not getting feedback from them. A lot of our continuing education conferences have been canceled.
Yeah.
I mean, they've all been canceled.
They're not doing them online?
Well, no, I'm on the board of directors of Southern Pain Society. And we were supposed to have our meeting in New Orleans in September. That's 14,
yeah, your mayor has canceled everything.
14 southeastern states in this group. And I'm on their board. And so we have these bi-weekly planning meetings. And so we've been debating, and by Zoom, but we're debating as to whether postpone the conference to later this year or cancel it totally. And so we've come up with, let's move it back to November and see by September what things look like for the future.
I thought your mayor sent out a proclamation that she canceled all big conferences for the rest of the year in New Orleans.
Well, this is like 150, 200 people.
Okay.
So it's not that big a conference. I was supposed to present on hypnosis at the European Hypnosis Society conference.
Oh, that would have been fun.
In Basel, Switzerland.
Oh, wow.
In August. Canceled.
Because the world is canceling events too, not just America.
Oh, right,
yeah.
sure.
So from your perspective, then the COVID-19 is kind of, from your perspective, anxiety you've seen increase, or you've read about it increasing in mental patients? Because I'm reading that it's a lot of increase. And depression.
Well, it is increasing because I think of the uncertainty.
Yeah.
You know, and you know, the people who have loved ones who are in nursing homes and can't visit them.
Or hospitals.
Yeah, or hospitals, and they can't, the people can't visit their families.
As you say about that, my little puppy, he had to go to the hospital about a month ago, to the veterinarian.
Right.
We were walking and he just collapsed in the back, his back legs. He just fell down on the back legs after we had walked about an hour. And he loves to walk about an hour in the afternoons, at night. And he just collapsed. And then I picked him up, and then he started walking again. He thought he was fine. And then I put him on the couch. I said, no, I'm taking you to the emergency room because he had labored breathing. Then when I got him there, he only had 20% heart and lung capacity. And he had just walked 3 miles, skipping and running around.
Wow.
The doctor says he's the toughest little dog he's ever seen. And but they kept him for 3 days on IV Lasix, some heart medication, and on oxygen because to get where he could breathe himself, unlabored. And but what they did at Sherwood Animal Hospital, and I will tell anybody, if they have a pet, to take them there, because this is the first time I'd ever known him to be sick like that. And they would send me pictures. Oh, I couldn't go in. They came, I'm giving, it's like a baby, you're a pet mom. And Dr. Leo there, hi Dr. Lee. Dr. Lee's been on the show before. But they come out and they take your pet and then they examine them and they, tell you, we got to keep him, this and that, you can't see him. They brought him out one time for me to tell him goodbye and he'd be okay. And he was grabbing to come back in the car. That's hurtful. Sure. He's very, very sick. And then the doctor on the phone told me he's only got 20% capacity right now. So, and when I got home, crying, driving, crying. And, but then they call me every 2 or 3 hours and they say, you can't come in, but we will send you pictures. And I thought that was so smart. And I wonder, are they doing that in hospitals to family members? Because it gives you some easiness about it, right? Because you're so full of anxiety. You're so upset because your child, your mother, your pet is hurting, and they're alone that you can never go back in there and see them and how they're doing. And when they did that, and they were so nice at that hospital, I would recommend them to anyone with any pet issue. So that's his veterinarian now, Dr. Stephen Lee. Well, if you want to tell people your number or something, we can, if they need help, clinical help. You take all insurances, doctor?
Well, I take a number of them.
Okay.
I take Blue Cross and Medicare. I take several. TRICARE. My number is 225-926-7500. And I have offices in Baton Rouge and Metairie, and that number works for scheduling appointments for both. And
the hypnotism, and then I'm going to close it off. The hypnotism, let's say you help with addictions, and that's drug and alcohol, smoking. Do you help with smoking? And overweight, overeating. What else? What else would be an addiction?
Well, gambling
Oh,
addiction.
yeah. Why couldn't I think of that? My first husband, that's why I divorced him. He was a gambler.
Right.
Yeah, I lost a lot of money.
But you know, I tell clients all the time when I talk to them about hypnosis, I have books on top of my bookshelf. This is when they're in office. I show them 2 books. Let's say those 2 books, one hypnosis for addictions, one for sports hypnosis.
Right.
I probably use hypnosis for anxiety and pain management more than any
So
other
you're
thing.
telling me you can stop my pain
No,
through
wait, let
hypnosis.
me explain.
Oh, okay.
I wrote those 2 books because there was not much written on them. But I use it more for pain and anxiety but I don't write those books because there's already a lot of books written about that. But if a patient comes in and they say their pain level is a 7 on a 10-point scale, 10 being the highest, of course,
Right.
and I hypnotize them, get them totally, deeply relaxed, and afterwards I'll say, well, what's your pain level now? And they'll say, about a 4. I'll say, wow, that's amazing.
Yeah.
That's more than a pain pill would have done for you.
Right.
See, but I didn't do it, you did it.
Right.
You see, basically it's teaching the patient coping skills, things that they can do, they can use on their own.
But is that just for that one day?
Well, but it's teaching them to practice
do
it
it.
throughout the day.
So it's all mental, but pain is not just mental. There's a physical
Well, yeah,
that happens
but
in the body.
You see, at the pain clinic, when the pain management doctor refers somebody to me, oftentimes the patient will come in and say, well, Dr. So-and-so sent me to you, you're a psychologist. Does that mean he thinks the pain's on my head? I don't say no, he doesn't think it's in your head. He has x-rays and MRIs. He has all these tests, diagnostic tests to show there's something wrong in your back or your neck or whatever. But in a way, pain is on your head because if you didn't have a brain, you wouldn't hurt.
Right.
It wouldn't register.
Yeah.
But then I'll go on to say, let me give you an example. If you were here and your pain was a 7 on a 10-point scale, and we lowered it through hypnosis to a 5, let's say, and you left here and got news that your loved one was in a tragic accident, what do you think would happen? They say, well, we'd go to a 10. And what do you think would happen if you left here and you got news that you just won a $20 million lottery? You say, oh, it would go down.
Yeah.
So you see, there is a connection between emotions and pain. We call it the mind-body cycle. See, so pain causes more depression and anxiety. More depression and anxiety causes more pain. So just like with the pain, with anxiety, I tell people, to me, hypnosis is the most efficient, effective way of dealing with anxiety. Because if I can teach you to be relaxed in situations in which you used to be anxious, you're not anxious anymore. You can't be, but one precludes the other.
Do any of your patients come off medications, drugs for
Some of them
anxiety?
decrease, yeah.
They can decrease the dose.
Decrease them, and occasionally altogether, get off them altogether.
And you're probably the #1 expert in the state on hypnosis, clinical psychologist. There are not many, are there?
They're not many.
Yeah.
I have a lot of referrals from other psychologists
Who don't do clinical hypnosis,
but
yeah.
they think the patient might benefit from hypnosis and they refer them to me.
That's great, Dr. T. Well, I think we're going to close it out now, and thanks for being here. I usually shake your hand. You know, I was looking the other day, handshaking, I was reading about it. It came from, was it ancient Rome or something, to prove you shook their hand to prove they didn't have a knife or some weapon in their hand.
Right.
Yeah, it was so funny. That's how it began. I know that over in Asia, you know, they do this. They bow. They don't shake your hand when they come and go. Well, come on back to Dianne Andrews in Black and White. Welcome back to Dianne Andrews in Black and White. Thanks for returning for our close. Today, I would just like you to be introspective. Think about who you are inside. And if it's everything you want to be, then continue being the best you are. If it's not everything in life that you want to be, then put a plan in place, as I talked about with Dr. T. Let's do some things in this time that you can be remorseful about it, or you can be happy about it and change the trajectory of your life. Because what's in you, happiness is only within you. If you have a real problem of being alone, now me, I think I'm alone too much, and that's a problem. But because I work all the time, and that's not a good balance either. But for people that can't be alone for 2 or 3 days by themselves and they get depressed, then learn to find a hobby, as Dr. T talked about, planting some flowers outside. Don just mentioned, the cameraman, he just mentioned play puzzles. More grown people are getting into puzzles. And you can get some puzzles that cause you to have good brain stimulation. And even the crossword puzzles in the paper. So there are things that we have gotten away from. Because I thought about it when I get my groceries delivered. That the guy who delivers my groceries is like when I was a little girl. They used to deliver the milk to our house. So we're going back to where our parents were before. And in a way, some of that is a good thing. But the loss of the greatest economy in the world is not a good thing. I always tell you, black and white, between those two are always shades of gray. Between black and white are always shades of gray. So look, listen, and learn. Don't look at one point of view. Don't look at only one television station or one newspaper. Investigate, or one thing on social media. Investigate, because everything out there is not gospel from anybody. But if you Google enough, you can find the real answers. When I was a little girl growing up in Marouge, Louisiana, I saw this spiritual show that came on every Sunday. And it said, if everyone lit just one little candle, what a bright world this would be. I cannot think of a better time than for all of us to light a white light, to light the world, our lives inside our bodies, and to illuminate the world and help make this COVID-19 disaster go away, or at least go away as far as you can continue on with your life. Thank you very much. We'll see you next week with another COVID show, where I'm doing 10 in a series. Good night, and God bless.